Sickle cell anemia is a disease that has no known cure. It is a condition that many know little about. It is this lack of knowledge that has led to many preventable deaths, especially among infants here in Kenya. KTN's Sharon Mumanyi spoke to a lady who has healthfully managed the condition for 33 years and sheds more light on managing the disease.
The giggles at Ruth Auma's home mirror the happiness that surrounds her life now. But this has not always been the case, as she has had to battle sickle cell anemia since the tender age of 8 years.
Nikiwa mdogo nilikuanga mgonjwa tena sana. Nilikuanga hata na on and off shuleni. Sikuwa napata masomo vizuri. Maumivu saa yote, macho zako ziko yellow saa yote. Kila mtu anakusimamisha na kuuliza nini mbaya na macho, hauna damu kwa mwili.
Ruth, whose parents were separated, was on and off medicine, especially as her mother could not afford it. This affected her education and she went through periods of immense pain. It is only when she met her husband 10 years ago that things looked promising.
Bahati nzuri, bwanangu mwenye nilipata, at least aliweza kunimanage vile niko. Sikuwa nimemwambia niko sickle cell anemia, but kutoka kwa familia yetu kuna mtu ndiye alimwambia niko sickle cell anemia na siwezi ishi maisha refu na tena siwezi pata watoto.
I got shocked as a normal human being, but I later realized even if I ignore Ruth, maybe I feel like I should marry a lady who does not have any terminal disease. Then sometimes when it comes to delivery time, issues come up.
Professor Walter Mwanda, a professor of hematology and blood transfusion at the University of Nairobi, rubbishes this myth. Like all other chronic diseases, he says the wellness of a sickler depends on how they manage their condition.
It is not true that most of the sickle cell patients die early in life. It is more of a measure of how easily we can detect them, how soon they can reach us, how quickly we can institute intervention. And if these are done quickly enough, then they actually live a life that is.
Sickle cell anemia is an inherited blood disorder where the red blood cells, which carry oxygen around the body, develop abnormally, usually assuming a sickle-like shape. The disease produces episodes of pain known as crisis, which usually occurs when the sickle-shaped red blood cells get stuck in blood vessels.
A syndrome must now have about 3. And a syndrome means it involves a big organ, like the lung, like the brain, like the bone, like the kidney, like the liver. These are life-threatening events. So immediately they notice an event, they should be able to contact a medical person so that it does not reach into a crisis. And a crisis does not end up in a syndrome.
Contrary to the negative talk around her, Ruth successfully delivered 2 sons, 11-year-old Banel and 1-year-old Brandon.
So to me, my mindset changed in terms of in a very positive way. Yeah, I felt like so Ruth is just a normal lady. Ruth is just a normal human being as much as she's feeling sick, and we can press on.
But immediately they become expectant. They need extra attention. They should be able to see us. As soon as that is done, there is a program we make for them. And this special program should be able to take them through.
But what's the specific danger?
But managing the disease is a costly affair, which is one of the biggest challenges for sicklers.
Yeah, so they're very, very costly. It is 5,000 sometimes, but this money is not there. So what we normally do sometimes, because it has been written, we go with the little money we have. Maybe instead of buying for 3 months, we buy for a month, or even for 15 days. We just go talk to the...
Wazazi sana sana ndio wanatakikana wa take care watoto wao, washughulike nao kabisa tena sana, especially kwa chakula na kuwatafutia hizo madawa. Ya ndio hata wakikuwa wakubwa wajue wanaweza jimaintain hivyo wenye walimaintainiwa na wazazi.
The hereditary disease is especially prevalent in Western Kenya, affecting up to 2% of newborn babies. An estimated 60 to 80% of these children die before their 5th birthday, a wanting scenario majorly caused by lack of awareness of the disease in this region and across the country. Sharon Momanyi, KTN News, Nairobi, Kenya.